In this short video, I want to focus on developing an intuition and understanding for how ROC curves operate and what goes on in an ROC curve. And let's see if we can even do this without using terms like precision, recall, sensitivity, and specificity, even though they're very useful and you should try to learn them after you understand what is going on. But let's keep it simple. Let's say that we have a test that identifies whether someone has a disease. In that context, a false positive is when the test identifies someone as having the disease, as being positive for the disease, when they don't have the disease. That's a bad thing, right? A false positive is a false alarm. That means that you are unnecessarily making someone panic and worry that they have some kind of a disease when they don't have it. So false positives are bad. A false negative, on the other hand, could be argued to be worse. A false negative is when someone does not have the disease, when someone has the disease and you're telling them that they do not have it. That means that they are merely going along, not aware when they could be getting treated. Okay, so the disease is progressing. That's really bad. So false negative is very bad. False positive is also bad. What is good is what we are looking for: true positives. Okay, so true positive is a case where somebody does have the disease and the test truly correctly identifies that they have the disease. So we want a true positive to be as high as possible. With this in mind, just look at the two axes for ROC curves and things will start making sense. The vertical axis is the true positive rate. We said true positives are good. We want this to be high, as high as possible. And the x-axis, the horizontal axis, is the false positive rate. Okay, false positives are bad. So we want this to be as small as possible. This should be as high, this should be as small. So the most desirable point in the ROC picture is the top left-hand corner. And once you draw a curve, you choose a cutoff that goes as close to the top left-hand corner as possible. So back to our disease, right? Let's say for ease that our medical test results only come between 0 to 1. Okay, so for every person who gets tested, they get a score from 0 to 1. And then when we look for those people who actually had disease and we look at the max and the min, the max was, let's say, something like 0.9, and the minimum value for those people, red means they have the disease, is I would say here 0.43 or so, okay? 0.43 or 44. On the other hand, if we look at those who did not have the disease, on the lower end they have a score of 0.8 in this test, but the highest is 0.52 or so. Okay, so in general we can see that there is a higher likelihood of disease as you go high up on the scale, and a lower likelihood of disease on the lower end of the scale. But this middle region is where there is trouble, right? That's the uncertain region. If someone has a 0.5 or a 0.52 or a 0.49, we don't know really. We can't be sure whether they have the disease or not. Now in these four dots, I'm just showing you the two min and max, and the min and max for a disease or no disease. But we don't have only 2 or 4 people, right? If you look at everyone who had the disease, we can start putting them down, right? The distribution, right? The distribution can be laid out. And you can see that all these red dots are those who had the disease, who tested positive. And these are all people who, when we did the results, came out, but they as not having a disease, okay? So we now have two overlapping distributions. And for ease, sometimes we like to represent those distributions like this. If we have this, we can sort of remove all the dots so that the curves and the distribution is a little easier to work with. Now, with this in mind, we can start asking ourselves, which cutoff value should we use? Okay. Again, for ease of understanding, I'm just pulling them apart separately so that we can follow what is going on. And remember, the question is, which cutoff value should you use? As you can see here, all these people are those people who have the disease, and these are all people who don't have the disease, right? We know that because we have tested them. Now, if I say that I want to keep 0.4 to be the cutoff, okay, it's very good, because anybody who has a test result of more than 0.4, we're going to label them as having the disease. And this is very good because everybody who has the disease will get caught. We will not miss anybody. But look at what happens here. These poor people who are actually negative cases, that means that they're perfectly healthy, for whatever reason, this test score for them comes out to be 0.42 or 0.44 or 0.5 or 0.56. All of them we are saying, hey, you have the disease. This means that we are having a very high false positive rate. Okay, since we don't like that, we could do something else. We are saying, hey, I'm having too many false positives, therefore I'm going to move my threshold, my cutoff to the other side. So let's start again, and this time let's be very aggressive, and we're going all the way to 0.6. In that case, for sure you will catch some people who have the disease, and you will never make a mistake about false positives because everybody is to the left, but this area again troubles us, right? These are all people who really have the disease, but we are labeling them as not being positive. So they are falsely called negative, false negatives, very bad. Because since we are not telling them they have the disease, they are not getting treated for it, and then the disease will progress and they will get worse. So they are wrongly being marked as negative or false negatives. And this whole dilemma is what the ROC curve is trying to help us with. In that context, let's look at actual examples. You see here, this is called the confusion matrix. We have false negatives 812 people, false positives 571 folks when you had a threshold of 0.5. We don't like this. He's off diagonals. We would like the false negative to go down. If you want to do that, you could say that, hey, I don't want to miss anybody, right? Because if they have the disease, I really need to catch them. So you bring the threshold all the way to 0.5, and that works up to a point because 812 became 115. But see what happened. It popped up elsewhere, right? All these extra false negatives showed up. Too many cases being mistakenly marked as positive. So you'll be treating people who don't need to get treated, or you'll have to test them again, and it's not a very good one. Okay? In that case, now, as you can imagine, we want to go the other way. What if I move the threshold all the way to 0.95? And then I want to be absolutely certain before I label anyone as having the disease. I don't want anybody to panic unnecessarily. We don't want false positives. Okay, so false positives go really, really down, and that's wonderful. See what happened. This is terrible. We have missed 1,700 people, right? 1,699 people have been falsely called negative, whereas they should be getting treated. So we cannot win here. And this dilemma, this exact dilemma, the fact that we'll either have to miss actual values or call people who are fine to be unhealthy, is the whole dilemma of this ROC curve. Look at the vertical axis, true positive rate, horizontal axis, false positive rate. And depending on our threshold that we chose, we could have it this way, in which case there is a very, very high false positive rate, or we could have a very high, very low false positive rate in this side, but then we'll miss a lot. And as you keep doing there, finally you want that 1 point. That's a sweet spot. That should be the cutoff which is closest to the top left corner. What is that threshold value is the one that sort of trades off very well between true positive rate and true false positive rate. That's what an ROC curve does. Hopefully that was helpful and you developed some intuition. Thank you for your time.